Monkeypox is here, and it's terrifying. In this video, I will tell you all you need to know. How is it transmitted? What are your chances of survival? How can you avoid it? How can we stop its spread? Monkeypox is a viral infection, which is caused by a virus called monkeypox virus. The virus belongs to the same family as the varicella virus that causes chickenpox. However, unlike chickenpox, which has an incubation period of 10 to 21 days, monkeypox has an even longer incubation period of 6 to 13 days, but can be as long as 17 days. That's why it is important to take steps to prevent its spread. The symptoms start out like a flu with fever, headache, muscle aches, and fatigue. Then it progresses to a rash, which starts out flat, turns into raised bumps, and then into blisters. These blisters turn into pustules, which then scab over. Scabs then fall off, leaving scars, which last for weeks to months. That in itself is pretty terrifying. But we have seen much worse in the past year alone. Out of 8,000 cases reported since the start of the outbreak in May 2022, only 5 people have died. The good news is that the current smallpox vaccine provides some protection against monkeypox. According to the World Health Organization, 80% of people who received the vaccine were protected against monkeypox. Another piece of good news is that monkeypox is not airborne. You cannot catch it through the air like you can with COVID. It is transmitted through close contact with an infected person or animal, or by touching contaminated materials such as bedding or clothing. So if you avoid close contact with people who have monkeypox, you should be fine. Well, almost fine, because monkeypox can also be transmitted through respiratory droplets. Respiratory droplets are expelled when an infected person coughs or sneezes. However, these droplets are much larger than those of COVID-19, and they can only travel a few feet. So, to avoid getting infected, you should avoid close contact with people who have monkeypox. Wear a mask if you're around an infected person, and wash your hands frequently. Also avoid contact with wild animals, especially primates, rodents, and monkeys. If you have been in close contact with someone who has monkeypox, monitor yourself for symptoms for 21 days. Isolate yourself if you develop symptoms. All 5 of the ones who died were from Nigeria. Monkeypox has a case fatality ratio of 3 to 6% in Nigeria. However, outside of Africa, there have been no deaths reported so far. Most people who get infected with monkeypox recover fully. However, some people may experience severe complications such as pneumonia, encephalitis, or even death. People who have a weakened immune system are at a higher risk of severe disease and death. But if you're young and healthy, your chances of survival are very high. The good news is that monkeypox is very unlikely to be fatal. Now, how can you avoid getting infected? Wash your hands and avoid touching things that's been touched by lots of people. Avoid the infected and do your best to shield yourself from the virus that is the monkeypox. I hope you learned something from this video. If you like this types of content, please hit the like and subscribe button to help this channel out. Stay safe everyone, and thanks for stopping by.